Hi, and welcome to CulinaryRx from MedPageToday.com. I'm Dr. John LaPuma of Chef Clinic and Chef MD in Santa Barbara, California. My guests today are Dr. Ingrid Kolstad, who's editor of Advancing Medicine with Food and Nutrients from CRC Press and a faculty associate at Johns Hopkins University, and Stephen Shesker. Dr. Stephen Shesker is a board-certified orthopedic surgeon and assistant clinical professor of orthopedic surgery at NYU School of Medicine. As well as a former consultant to the Newark Rangers hockey team. Today we're trying to help a patient who needs a total knee replacement. And here's the case, which you can also read and comment on at medpagetoday.com/culinaryrx. The case is here. A 61-year-old Latina woman who worked as a railway engineer presented to an orthopedic surgery clinic in December. Radiographs showed severe bilateral osteoarthritis changes, more on the right side than the left, and so in June she underwent arthroscopic washout and severe tricompartmental degenerative changes there were noted. She was managed non-surgically with anti-inflammatories, activity modification, injections, ibuprofen, and Tylenol, but her pain got worse, and after 2.5 years of this, she and her surgeon planned a total knee replacement. At home, she cooks for her family of 5. She rarely eats fast food, and sometimes she drinks apple juice for energy. She makes tamales on Sunday with her sisters, which they enjoy. Her body mass index is 26.8 kilograms per meter squared, so she's in the overweight range. Her lab tests show a glycohemoglobin of 7.1%, which is higher than normal and probably diabetic. And otherwise, she has normal screening tests. She's about 3 months to prepare for her surgery, so she asked her surgeon, what should I eat beforehand to make sure my knee is in the best shape to heal the replacement, and how should I change my diet after the knee replacement so that it heals rapidly? On our website, medpage.com/culinaryrx, here's some of what our reader suggested. William Watson says she should stop drinking sugary drinks like apple and orange juice. William Van Witt says that in Australia, patients getting total knee replacements put an average of 20 kilograms within a year. Dave Nalini says that she should eat an anti-inflammatory diet with more turmeric and ginger. She should put sesame oil over the joints and avoid nightshade vegetables, as well as maintaining good vitamin D3 levels. And so we have a variety of opinions. I'm going to ask Dr. Kolstad first. Hi, Ingrid.
Hi, John.
Hi. There you are.
Well, it's great to be here. You can hear me okay?
Perfect. So what should this patient eat? What should she eat and drink, and what should she not eat and drink? Let's start with pre-op. Is there what she should do in the 3 months before surgery to get ready from a culinary and dietary perspective?
Well, I was interested, I agree with the comments that were written in. There were certainly lots of good suggestions. I think what I heard from your readers and reviewers were comments about decreasing her sugar intake, especially with juices, an anti-inflammatory diet, avoiding nightshade plants, which are very common in Latino culture. That would be the pepper. Some people say cayenne pepper is good for joints because it increases stomach acid digestion. So to the extent that it makes your stomach water the way it makes your eyes and palate water, it's a good thing. But it is a nightshade, and some people react to that. Generally, the people from the cultures where the food originated. Now, this is interesting from an archaeobiology perspective, that the peppers used in Asian cuisine and Chinese cooking originated in Central America, and this was proven by a friend, a colleague of mine who was doing the dig site in Mexico. So I think she's in the category of people who have used to that, and probably doesn't, the nightshade advice, while good advice, probably doesn't apply to her, since for generations she's her ancestors have presumably eaten tomato and some eggplant and lots of cayenne pepper mixed in with chocolate, which I think may also have some favorable anti-inflammatory properties as well as some others. So if it's eating according to your ancestry, that probably is fine. So what was the hook for me about pre-op and what makes her case particularly interesting to me is her occupational exposures as a railway engineer.
Because Amtrak has crummy food? Why?
Asbestos, until proven otherwise through the breaks. And it's difficult to prove asbestos. And what we found is that asbestos isn't only mesothelioma. The new research on nanotechnology has looked at asbestos more closely because asbestos is one of the first nanoparticles that we have rules or regulation on. What the concern is that asbestos can accumulate in sub 1 nm, one nanoparticle or less.
You mean it's the etiology for her osteoarthritis?
Yeah, and contributes to the osteoarthritis and to the diabetes, specifically renal conditions and neuropathy. So that's something to keep in mind. And what I've learned about it is that cilantro is a great food. Not only is it an ethnic food, it's a food that actually can mobilize asbestos by some newer tests. And so what does she have to lose from that? If she takes asbestos every day, she's getting folate, she's getting anti-inflammatory, she's getting an alkalinizing diet. She can drink it the way she would apple juice. It's part of her culture. It probably goes in the tamales. And if I could say she could get a $1 bundle of cilantro and either juice it or put it in a smoothie or just eat it as a salad with a little bit of oil and vinegar on it. Yeah, I think that would make a difference for her pre-op.
That's really interesting. I would completely unexpected answer. We'll elaborate on that more. Dr. Sheskier, what should this woman eat pre-op?
Well, the first thing that's interesting to me is a patient that's going to undergo a total knee or any type of replacement. You know, its success in part is related on the bone stock that's there. And so how old was this woman again?
61.
So she's postmenopausal, and she lives at a latitude that they don't really get enough sun, particularly this last winter. And so most patients, I will get actually a vitamin D level to prove or disprove do they need to be on not just, you know, dietary D sources, but actually, you know, on a pharmacological treatment for this. So that's one of the first things that I would do in the pre-op, because sometimes you need to mega dose them, so to speak.
What level do you look for?
Should I say that again?
What level do you look for?
Well, each one of the labs is a little bit different, so I just go by the reference. It really depends on the lab. But so aside from that, that's one of the basic things they need to do, particularly in the latitude we're in. At least I'm in New York City, so that's something I would do. The other thing that is of concern is her weight. Now, they've done some studies, like I have patients come in all the time. They say, well, I'm overweight, I have this bum knee, if I could only just exercise, I would weigh a lot less. Well, there's a recent study about a year or two ago, where they took patients who had this thing like, I'm going to lose weight as soon as you fix my orthopedic problem. In reality, they checked like 3 years later, and they were still all overweight. So obviously this has to do with a generalized intake thing, and obviously I don't need to bring Cole's Newcastle here, but in my experience it's always been that exercise will help you maintain a weight, but rarely does it actually help you lose weight. And so that has to do with her overall calorie consumption. Obviously activity level has something to do with it, but that's really where the point comes home. I tell patients, I say, listen, according to your BMI, say you're 30 pounds overweight. Well, guess what? Put a backpack on your back, put 30 pounds in it, and let's go for a walk. The majority of people at 61, 62, 63, they're intuitively they're going to say, well, I'm not going to be able to walk so far. I'm not going to be able to go that distance. But that's what they've gradually gained this weight. And so this is something, some of these aha experiences the patient have to have for themselves. And this is one of the sort of the stories I tell them. And ultimately, too, I don't know if you guys are a believer, but a lot of patients in the preoperative situation, even to avoid surgery, I still am a believer in glucosamine supplements. Now, mind you, you may smile or not like this, but there are some research depending on what the size of the glucosamine is, whether or not you can absorb it. Now, not everyone can absorb it, and I had about 5 or 6 patients come in I think it was about 10 years ago, where that book Cure for Arthritis came out, and it went over treating arthritis with glucosamine. Well, I had 5 patients who were chronic patients who had arthritis who came in almost like one after another saying they were better. And I'm thinking, God, I'm the best doctor here. I finally got therapy, had this done. And they're actually doing well. And it wasn't, so I always, look, the FDA marks glucosamine as possibly effective. And I don't think it hurts in general for patients with arthritis to at least forego that. Now, mind you, as you know, like with the GNC recently, where they found out a lot of the supplements they had actually have no supplements in it. I'm sure you've read this. And so the big thing is, because it's not governed really by the FDA, these food supplements that are available out there, you have to go by testing by independent organizations that guarantee it's there. But for glucosamine, for instance, you can have all the glucosamine in the world, but if you can't absorb it, you might as well be eating sand. And so there are studies showing that it's more medium-chain glucosamine. And so I will recommend that. But
but from a dietary perspective, does a weight loss diet help to heal the knee replacement, or get her in better shape? Excuse me, I misstated that. Does a weight loss diet help the surgery go better? It will improve wound healing, or does it have a neutral effect?
It has really a neutral effect. It's more of a long-term effect in terms of the status of their overall health, muscle health.
What about post-operatively? What will help? We heard about the anti-inflammatory approach initially. Post-operatively, are there foods or drinks that make a difference?
In my experience, I do not recommend any specific food or drink.
If she lost weight after the surgery, would it help it heal?
Not necessarily. See, the situation is they've been doing studies for years on weight, what a patient's BMI is when they do a total ankle, a total knee, or a total hip. And the tendency is that people who are overweight have poorer results. Mind you, some studies, and I'm not sure how good they are, but we'll say, well, it doesn't really matter. But the difference is if you're operating somebody, you have to cut through 3 inches of fat to get to their knee or wherever you're going. There's more dead space, more likely to get an infection or have a seroma or a hematoma and have a post-operative thing. But I can't say there's a direct, like if you're overweight, you could have a problem. But it makes the surgery harder. It makes the surgery longer, and the patient themselves usually are not in as good a condition if they're that overweight.
Dr. Kolstad, do you know of any data to have improved healing postoperatively? And this has become very important from not only an individual patient perspective, but also from a readmission within 30 days, as Medicare now dings hospitals for patients who have had joint replacements who return within 30 days for any reason. So there's now strong financial motivations on the part of many hospitals and health systems to learn what will help them heal and keep them out of the hospital for that period of time. What data do you know to help us with healing post-operatively?
Yeah, a few comments on Stephen, and I'll certainly address post-op approaches. I've been fascinated by some of the research coming out of NIH and other institutions worldwide about the microbiome. And I've come to the conclusion that we're often asking the wrong question when we focus on whether we're absorbing a certain nutrient. I think we should be asking is this helping the right bacteria flourish in our intestinal tract, whether we're absorbing it or not? I'm just kind of putting that out there, and that may be relevant based on the chemical structure of glucosamine. I think it's relevant to this patient and may explain part of the variability in responses that we're seeing to glucosamine. So I figure I could ask this patient to make 5 changes, and I'm not sure if one of those 5 would be glucosamine or not. Partly because I got the impression there may be some food insecurity issues around her large family, her current illness, and whether she's still working as an engineer on the railroad or is she on disability? How long is that lasting? She has sisters. How many sisters? Is that maybe shared living? She doesn't go out to eat or buy fast food much. Maybe that's because of some financial concerns as well. So I'd really like to help her do things that she's already familiar with that aren't going to cost her a lot. But that said, protein is expensive, and I think she's protein deficient. I don't think her current diet is getting her more than minimal amount of protein, and then because of her diabetes and her trending increase in weight, it doesn't seem like her digestive system is well enough to absorb the protein. And there it really matters whether you're absorbing it or not, because as our stomach acid goes down in age, our protein needs go up. So I would ask her specifically about forms of protein that are well absorbed and utilized to build muscle. I would start at pre-op with the assumption that it's going to be most effective post-op, and that extra protein will also help her stabilize her blood sugar. So when trying to get her off of the apple juice that she's drinking for energy, I would like to say she should drink water, like water with lemon and lime, but that's unlikely to give her energy. But a drink that has some protein in it, if she treats her body like an athlete, and she's having a surgery that some athletes need too, so we want her to be hydrated, hydrated, hydrated. Some of the listeners will probably know Dr. Faridun Batmangalig, the author of Your Body's Many Cries for Water. And he authored a chapter in a book. I got to know him through that. And he said, of all the joints, the knee is the one the most susceptible to dehydration. Because he had it down to the detail of the anatomy, which I'm sure Stephen could comment on. So I would want to make sure she's well hydrated, but we need to find a substitute for apple juice. So one of the things I would do already pre-op, thinking that post-op is most important for hydration, is lemon and lime added to a water. Maybe she likes that. Maybe she likes to spice her food with, there's coriander tea, and coriander is the seed of the cilantro plant, so maybe she's getting cilantro again. Ginger, fennel tea, chamomile tea. I would really explore the possibilities of forms of hydration that work for her.
So,
and forms of protein.
In terms of the direct, do this, don't do that, would you say have a bunch of cilantro daily for anti-inflammatory and microbiome reasons, and make sure that you have 8 glasses of water daily? with citrus to make sure you're adequately hydrated? How would you be very specific in your direction to her beginning pre-op and then handling over post-op?
So I would give her pre-op instructions, no more than 5, to the post-op, and
Okay,
I would base my recommendations with 2 more pieces of clinical information that would have really helped me. One is a tox screen, because heavy metals is also a big occupational exposure for railway workers, and the more minerals she has, if she has toxins, I would focus on ways to remove them in addition to cilantro. And the other thing I'd want to do is check her kidney function. I know her labs tested out, but I still, with the probable diabetes based on the high glycosylated hemoglobin and a probable exposure to asbestos, I would want to know her kidney function before I gave any directions on protein consumption, because the protein is going to, obviously not going to give as much protein or the types of protein if she even has early kidney impairment. So, but say those tests are normal and we can't test for asbestos, I would still say cilantro, 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 hydration, 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 and I'm looking at how she could be hydrated so that it can also give her an alkalinizing benefit and get her enough fiber and get her the protein that she needs. So my specific instructions would be get protein from eggs. She would pick it with me, so I'm not going to tell her what protein to eat. But if she likes to have an egg a day, I say have a hard-boiled egg a day. It's not as damaging with the cholesterol if it's hard-boiled, because it's how it's prepared. So I'd say, egg is a great source of protein for her, and would look at whey protein, maybe some smoothies with whey, more rice and beans or ethnic foods. When they have the fiber as well for her microbiome. So those are the things I would focus on, and I would pick 5 recommendations that she's comfortable with, that are in her culture, within her price range, and compatible with the 2 other lab tests I'd order. Hope that spoke to your question, John.
It did. Yes, it did, Ingrid. Steve, what do you make of these recommendations? They're not traditional orthopedic sorts of recommendations.
I'm still getting over the microbiome, because I read some studies like we're just life support systems for the microbes, and they're telling us to eat chocolate, and they're telling us to actually guiding what we do for a living and what we eat. That's my understanding of some of the most recent research that actually is actively, and I thought it was the federal government.
The bugs are winning.
It is the federal government. It's just inside of it.
So look, if the patient comes in and you cut them and they heal scratches normally, and their gamma globulin levels and their white count is normal, a lot of, I deal, at least for me, and I apologize that I'm on the show, but I'm dealing with people. Were they eating enough? Or these, because I deal with patients with HIV and diabetes that are actually malnourished, and people with chronic illnesses a lot of times. And so I'm looking at lab tests all the time, and obviously, we have hyperalimentation and other needs like that. But if people have low protein and people have low white blood counts, those are serious things. Now, whether or not it makes how much of a difference it makes in terms of a percentage, and would you be able to prove that there's a difference between one group and another based on their diet, unless they have a very skewed diet, I think would be hard to prove. But the majority of people, the human body is amazing, and it really heals a lot of things despite what you think what's going to happen. And so the microbiome, I'm still reeling in my mind on this, and I think we need more research in that. The thing that I do though with patients, because of the era we're in, because there's a lot of information out there. Sometimes I think I should make a list of all the things I should be eating and not eating, and then I figure out. I don't know which one, because there's some things that are on both sides. But we do, from an anesthesia standpoint and a healing standpoint, we are asking, there's a lot of, St. John's wort, and you've been taking too much omega-3 or something, can affect bleeding, etc. And so we, for a pre-op visit, we go over all the supplements they're taking, because patients are taking lots of different types of supplements, and there's a lot of information out there, some of it hard, some of it soft. And we need things like the young doctor here, who's been writing books, and like yourself, to go into this and find out the scientific facts, because there's a lot of fallacies and a lot of things that may be true. But humans have been plugging along for a while, and I'm sure we can do without cilantro. But
well, one of the things that does emerge is that, and I reviewed this literature before our show, is that there's really very little human data about this very specific problem, knee replacement pre-op and post-op, which is a shame, because it's such a common procedure, and because people are so really very interested in exactly this question. And so we have actually, from both of you, two different approaches that are complementary, I think. Ingrid mentioned that your body requires more protein and actually also calcium at this time, so having foods that are rich in those nutrients might be helpful, as is prevention of infection, and of course, vitamin C, zinc, and vitamin A are helpful there, and foods rich in those. But there really isn't very strong scientific data. We do actually need more research in this area. So you have here now two specific suggested eating approaches and plans and prescriptions for our patient who needs a total knee replacement. For more information, please read our transcript and the references on food for knee replacement at medpagetoday.com/CulinaryRx. I want to thank my special guests, Dr. Ingrid Kolstad of Johns Hopkins University and Dr. Stephen Sheskier of NYU. Please comment on this discussion and share it with your friends and colleagues, and ask your own doctor to write a CulinaryRx for you today. Thanks so much. Glad you're here.